Good afternoon, and thank you for joining me for the first Georgia Chamber Recovery and Resiliency Roundtable of 2021. I want to thank all of you for being with us today. You can also watch this on replay on our YouTube channel, or you can catch us on our podcast series where we will rebroadcast this in the coming days. Before we jump into our first guest of the year, I want to remind all of you that our next roundtable will be February 4th at 11 o'clock. We'll have Alan Adams with the SBDC to talk about the next round of PPP and how small businesses in Georgia can access those resources and the new rules that have been promulgated to that end. Also want to tell you that for those of you that are part of our 401k or our Smart Health Plan insurance program, we have a brand new toolkit for you that's now available at gachamber.com. So please go there to get the latest information and updates and a whole new toolkit for you to use with your employees. And finally, I want to remind you that our Recovery and Resiliency landing page is still live. We're not out of this yet, and we continue to update that literally every day with information from the CDC, from Dr. Toomey's office, from Governor Kemp's office, from the federal government. And so continue to go to gachamber.com/COVID-19 for the latest information and updates. But today I'm happy to be joined by Dr. Kathleen Toomey, the Commissioner of Georgia Department of Public Health, who's been with us and helped us through this entire process over the last 10 months. And Dr. Toomey, I know we're going to talk about vaccines today, but first let me begin by thanking you for your public service, all that you've done for the business community, for the citizens, for our friends and neighbors in this state. I hope you took time off in the holidays, but if not, we understand and appreciate you continuing to work for us. And I'd love, before we talk about vaccines, maybe just tell us a little bit about where we are today with our positive ratings. Are we seeing still an upturn? Are we on the downhill slide? Tell us a little bit about where we are today, and then we'll jump into a discussion about vaccines.
Oh, sure. Thank you so very much. It's so great to be here with you today. And let me just say that I really feel that it's such an important part of my job to be able to support the business community, and have since the beginning. And I'm just really thrilled to be part of this discussion and this ongoing collaboration, which I think has been beneficial to the business community, but also to public health, even as we move forward into other areas. I mean, first of all, I'll say we saw some of the highest rates we've ever seen, including hospitalizations and deaths in Georgia, really in the last month or so. And although those rates are going down, so we've seen a small but steady decline, the rates are still quite high. And so the message is still, we need to, even as we roll out vaccine, we still need to remind everyone to wear a mask when you're out in public spaces and near people and can't social distance, wash your hands, follow the public health guidance. And I know I'm wearing a mask because I'm in a room with other people, and sometimes you can't always hear me very clearly. So if I'm sounding a little mushy, that's why it is. But we also are seeing the emergence of that UK variant here in Georgia. We have at this point about 14 identified in various areas of the state. So we know that because we're doing limited testing with CDC to do surveillance for this, that there are more cases likely everywhere. And so that just tells us, even more importantly, that we have to continue our mitigation efforts. I know everybody is tired of this mask wearing, and no one more than me, but I think that is a message we have to be continuing even in the workplace, because of the concerns and how much easier this particular variant is to transmit. So fortunately, the vaccine does seem to work against this variant, so you're protected, but the vaccine isn't 100% effective, and you can still get an asymptomatic infection and potentially transmit even after you're vaccinated. So I think that there was the sense that, oh boy, I'm vaccinated now, I can throw away my mask and, go out and do everything just like I used to do. And we're not there yet, not in any place in the United States. I mean, there still has to be precautions taken, and we still need to follow this public health guidance as we move forward. To the business community, that means please ensure that your staff, if they can social distance, can wear a mask, in the work site, can telework if that's more convenient, that there's hand sanitizer and easy ways to wash your hands and maintain social distancing. It's been very interesting. Some of the businesses I've worked with, even at the polling sites at the election time, did a beautiful job of keeping everyone socially distanced and mitigating. But then in the break room, everybody took their mask off and ate their lunch. And we had a huge outbreak among election workers, which is interesting. And I think the answer wasn't that we shouldn't have in-person elections. The answer is we need to be conscious of the fact that the break room is often the site of transmission, whether it's in a poultry processing plant or even at an election site.
So, Dr. Toomey, speaking of masks, and you've got yours on, and I appreciate we wear ours here and everywhere that we go. A lot of discussion lately about wearing 2 masks or 3 masks, and I'm curious if you've got a surgical mask or an M90. Do you still need 2 masks? Tell us a little bit about what you recommend.
That was a new recommendation. I have not seen any data that actually supported that. I think the idea is that this variant is so easy to transmit that you're trying to put as much protection between yourself and others from you, that might be more helpful. I don't know about you, but an N95 mask is very difficult to wear all day. This is not an N95. This is just a traditional sort of surgical mask that I can throw away at the end of the day and get a new one. N95s have to be fitted. They're very tight. You've seen the pictures of the healthcare providers with big rashes on their face from the tight fit day in, day out. I just don't think, quite frankly, that's practical for most businesses or certainly for those of us in the community. But there are concerns about just in the workplace, as you are among your coworkers, particularly if your entire workforce is back, as well as even going into stores and other areas. And so I think a mask, until we get more data, any kind of mask is better than no mask, which is where I think in many places we are here and in other places of the country. So we'll just continue to monitor this closely. And as we learn more about the variant itself, it may be a little more dangerous, may lead to more complications. We don't know. I think the first time I met with you, I said that it's a novel virus, which means it's new and we're learning. And every time I talk to you, I change the information I give you. And this today is no exception, as we're finding out that long-term complications can include clotting, potentially even bleeding disorders. So it's both ends of the spectrum. Health complications with the heart and other organs damaged. It's really been incredible what this virus can do. So I think regardless of your age, it needs to be taken seriously. And the mask is the least we can do as we roll out vaccine and try to stop the spread. Once we stop the spread, we can reconsider what some of these mitigation measures need to be.
So we're going to continue to promote that, but you mentioned vaccines. So let's switch over and talk about vaccines, because I know that's taken up a ton of your time right now. Can you give us just a high level, maybe first of all, just tell us the difference between 1A, 1B, and the different levels, where we are today and kind of what we're looking at for the next few weeks here. And then maybe we go into what the business community can do.
Great. And there's things you can be doing now and can be doing further down the road as well with all of your staff. Let me say, first of all, this has been an interesting challenge because this is a federal program really run logistically by the federal government. And we are allocated a certain amount of vaccines proportional to our population. And clearly, vaccine was limited from the beginning. And so it was kind of parsed out in little small doses, really. And the two different vaccines are very difficult to work with. And for those of you who aren't medically inclined, I think you're used to, going to your local drugstore and getting your flu shot, and it's not a big deal. But these vaccines are actually quite delicate. And they are messenger RNA vaccine, which never meant anything to me until I started studying it. But there's a little fatty code over this messenger RNA that is so easily disrupted that if you refreeze it accidentally, or even if you shake it rather than stir it, it's the opposite of a James Bond martini. I was saying to one of our staff that you can actually inactivate the vaccine. And so we even have vaccines damaged in shipment by the transporters that the federal government have contracted with, because they have established McKesson as the logistics firm that transports the Moderna vaccine to us either via FedEx or UPS, and Pfizer themselves ship it. But we have lost vaccine in transit just to us before it's even arrived. So then once it comes into our hands, it goes or directly to other providers, including hospitals and private sector physicians' offices, large practices. It has to be handled carefully, or we could lose that vaccine as well. So it's not something as simple and easy to use as, say, the flu vaccine or a tetanus shot. What I will say is on the horizon, and perhaps even in the next few months, there will be potentially an additional vaccine made by Johnson & Johnson. It's much easier to handle. You don't need to have all this special deep freeze and refrigeration and very special equipment. So that it is a 1 dose rather than a 2 dose vaccine, where these others are 2 dose vaccines that not only require freezing, but also require the special handling. So that's kind of background to say that we had to set up these procedures for this special handling, but also got very little allocated to us initially. Not because we were shortchanged. This was a nationwide problem. And so if you go to, it doesn't matter if you go to California or Alabama, all of us are saying the same thing. We need more vaccine more quickly. And so we've tried to allocate it as best we can based on both the population who is able to receive the vaccine, as well as what the needs are in that community. We're following CDC guidance and the immunization practices recommendations laid out a timeline and almost I don't want to say a hierarchy of priorities, but it looked at who should be vaccinated first in the system. And then we were initially following that to the T, but then quickly realized that older adults, and if you look at our data here in Georgia, individuals 65 and older have the highest rates of death and disability after a COVID infection. And it didn't make sense to move very quickly into younger age groups until we had protected the most vulnerable individuals. And so that early phase and what we are in now, we're calling 1A plus because we added these older adults, included healthcare workers high risk because of the work, both vaccinating and in the community taking care of patients, first responders, law enforcement as well, who are often at risk in the community, police, fire, EMS, who transport individuals. These are all individuals we are now currently vaccinating. It's a 2 million person project when you think about the number of people we have to vaccinate. And to give you a sense of the numbers, we are only allocated this week a couple 100,000 doses, which may seem like a lot, but then you think about the actual numbers. We have almost 2,000 providers and over 2.8 million requests for vaccine. So you can see the numbers don't add up with just a couple 100,000 doses. And so we can just give a little bit of vaccine to everybody or larger amounts to some here, some there, and try to ensure that Metro Atlanta is balanced with the whole rest of Georgia, because we want to ensure that everyone, regardless of where they live, have access to the vaccine.
So Dr. Toomey, in that first 1A plus group, you say there's 2 million individuals. Of those 2 million, how many today have received that round 1 or even round 2 of their vaccinations?
Over close to 800,000.
Okay, wow.
So we've done, and I was going to say, look on our own website for the accurate numbers. Okay. If you look, for some reason, the CDC website always has us behind. There appears to be some problem with the transmission of data to CDC, but our own website has the most up-to-date, accurate information, and we'll have it broken out into first dose as well as second dose. But almost 800,000, if we don't even pass 800,000 by the end of the day. We're really limited only by the amount of vaccine we get. So it's the allocation, which is at the federal level, that is the limitation right now. And I've said this even most recently to the new administration when I was on a call with them and several of my state colleagues. I said, we've got the people in place, we have the providers in place, we have businesses lined up to help. We just need vaccine. We don't need federal agents coming in to help us. We can do it. Give us the vaccine.
So Dr. Toomey, so that's 1A plus. Talk to me about what's the next group? Are those essential workers? And help our listeners understand where different types of businesses might fall, or just average Georgians might fall.
Well, first of all, I think that businesses, regardless of your size, should think about being a closed pod. I mean, right now within businesses, if you have staff who are 65 and older, you can begin that vaccination process. And we are actually working, for example, with some large businesses who have chosen to be what we call closed pods. They'll be vaccinated themselves. We won't be coming in. They have Delta, for example, and I don't know if they're on the call, have contracted or will be contracting with CVS, and will be able to vaccinate a large number of their staff who are eligible currently, and then be prepared to move on to the next phase when we get into various essential workers, which will likely be, again, done incrementally because the vaccine dosages will still be limited. But in that essential workers, we're looking at things like teachers and educators, as well as the broader business community, depending on what that business may be. But I can't give you an exact date because a lot of it depends on the vaccine availability and how quickly we can get through this large number of older adults. The administration, when I talked to them over the weekend, said that you can't expect to have the amount of vaccine that we thought we would have now until probably April. And that was such a disappointing message that I've tried to convey every press conference, because I think the expectation for what we can deliver is dependent on the government giving us vaccine. And so we are the ones that look like we're not doing our job, when in fact we have to rely on the source of the vaccine.
Right. So let's go back and talk about the closed pod model for a minute, because Delta is a great member. I think they've been a great example about how you take care of your employees, how you step out and you social distance, and even the testing to that end. But if you've got another large employer in Georgia, say a large manufacturing facility that maybe have people that are at risk or over 65, how would they go about doing their own contracts and developing that closed pod model? Do they work with your office? Do they work independently? How does that help us understand that process?
No, I mean, the vaccine is ordered through our office, but they could identify a provider, or if they have a medical provider that's part of their business, and many businesses do have a medical unit, they can become a provider just by registering on our site. and I can provide that information afterwards if you like. And once you're a provider, you can order the vaccine, and it can be identified to be focused on the workers in this particular industry, whether it be a Kia plant or some smaller business. If it's a very small business, and I'm sure there are small businesses listening in, you can very easily work in partnership with your local health department. I do know, for example, even just here in Metro, that Gwinnett has gone into some local businesses to be able to vaccinate those older individuals in that business setting, and probably elsewhere throughout the state as well. And so it's kind of two different models, either bringing in a provider to work specifically for the business itself, large or small, or partnering not just with public health, but another provider. It could be a pharmacy, it could be who has vaccine and can come and bring it to the facility, or some other medical provider who can provide the vaccines on site.
So I would assume then, since really the key there is to register as a provider, if a business is really being smart right now, they ought to be looking at 4 to 5, 6 months down the road when there's more vaccine available and you're inoculating younger workers. Go ahead and start that process now. Go ahead and register as a provider now and get everything set up so you're ready to go.
Absolutely. And,
okay.
And hopefully it'll be even faster if they can ramp up production of this kind of difficult to use but very effective vaccine, or this newer vaccine that's not yet approved, but when it does, it'll be much easier, single dose, don't need to worry about the 2-dose regimen. And I think for the business community, I think that'll be much easier because it'll be one shot and you'll be finished. And they're anticipating that the rates of effectiveness will be nearly the same. So it's well near 95%, which is really quite.
And to that end, I want to go back to what you mentioned a moment ago. So once you get that vaccine, whether it's the one time or you've had it twice, talk to me about the concerns, two-part that we hear from people, right? One is what are the side effects? Are those manageable? And then two, can you still transmit the disease? I saw someone the other day who said, hey, I've already got the vaccine. I don't have to wear a mask anymore. Tell us what the truth is here. We need to know.
Yes. I mean, as I said, the truth is still evolving. I think the feeling is that you probably can still become infected and possibly transmit. But even as we speak today, there's studies being done to determine how significant that is, if at all. But however, CDC still recommends that even if you're vaccinated, that you should wear a mask, particularly while the rates are so high, and will need to quarantine if exposed. And I know that was not a popular topic of conversation when I was talking to the school superintendents yesterday, because I think the expectation was if we get everyone vaccinated, then we'll never have to quarantine again. And I kind of laughed and I said, this is not a get out of jail free card. We can't do that until we actually know better about what the actual benefit of the vaccine is. The vaccine prevents serious disease and prevents death, but whether it actually prevents transmission, even from asymptomatic infections, is still being studied. So I think we need to still maintain caution, and again, all those precautions we talked about, including mask wearing and social distancing, having hand sanitizer available to your employees, will still continue to be important, particularly until we can get the state fully vaccinated, and also overall in our country, bring the rates down to a level much lower than what it is now. I do want to make one point, in that there's so much misinformation about, frankly, a lot of this virus and the vaccine. I've heard rumors that many people have died from the vaccine, which is absolutely not the case. I heard people tell me to my face that Hank Aaron was killed because he got vaccinated 2 weeks before he died. There's absolutely no, to my knowledge, there's been no death associated with this vaccine. Somebody may have died several days later, but there are other medical underlying conditions which may have led to that death. The usual side effect of the vaccine is it can be particularly a very sore arm for a couple of days, sometimes headaches, sometimes a little feeling of malaise, like you're getting the flu, which may be even worse after the second dose. But it's generally very mild and not something that you would even need to stay home for. Some people have an allergy, and that in itself is very, very rare. Just a handful of people in the whole country, and as you probably read in the UK. But it's not something that should deter people from getting vaccinated. But there's a tremendous amount of misinformation on the internet, and I read that Bill Gates is now tracking my brain because there's a chip in this. And you probably read the same things. I don't know where this comes from, but I wish I could dispel all these myths, because it really is standing in the way of us being able to get the kind of preventive effect of the vaccine that we need in the state.
Right. I do have one other question I want to ask you before we lose you today, but I do want to make a comment about the misinformation. You know, we're hearing people taking over-the-counter drugs or drugs that were meant for animals because it curves the symptoms. None of that is true. People should only do what their doctor tells them. They shouldn't self-medicate with this, correct?
Oh, absolutely not. I mean, I've heard them taking anti-parasitic drugs that I used on puppies when they were little. I mean, it is not, let alone some of the other drugs. Absolutely not. There are some very effective drugs to take if you become infected.
Yeah.
And the monoclonal antibodies have been a very good, have had great impact on preventing hospitalizations if given early and before you become so sick you require hospitalizations. Once in the hospital, we know so much more about how to manage patients with the use of remdesivir, dexamethasone, not to put people on ventilators if at all possible, because it's very difficult to wean them off later. So all these things, but I think the avoiding some of the kind of non-traditional remedies that really probably won't help and could even harm you is something to bear in mind.
So last question, Dr. Toomey, and we've had this discussion with other folks on some of our board calls lately. Do you have any insight on the actual vaccine itself? I mean, is this something I'm going to have to get I read today that they were developing a potential booster shot that you get annually. You know, is the vaccine going to take care of me and cover me for half a year? Any insight? I know this is all new and there's lots of research, but we're curious.
No, we actually met with the developers of the vaccine, and they said they were hoping the impact would be for as long as 4 years before you would need a booster. Okay. Obviously, the factors that you have to consider is how your own antibodies that your body develops after that shot can be measured. And I think what they're doing right now is seeing how these antibodies drop over time, and that will help, be a sign of when you need to be revaccinated. But the other thing is whether new variants emerge that actually are resistant to the vaccine. You may need to get a booster that is effective against these new coronavirus variants. And I think that all is something to bear in mind. But if I can have one last word, I mean, the business community is such an important partner to us here. I really see our role as fundamental to ensuring that businesses can continue to function effectively and strategically and throughout this pandemic, and working with us to ensure that you have access to testing and to vaccine throughout this as we progress and learn more I hope will be part of that success story in Georgia now and in the future. So.
Well, Dr. Toomey, we have been and will continue to be your partner and do anything that you ask us to. We'll get that information about how to be a provider for larger employers onto the website and continue to give everything that you to our folks. And I want to remind all those that are listening to us today, you can listen to this or share it on our podcast or on our YouTube channel, and also encourage you to join us on February 4th at 11 o'clock for a discussion about small business access to the new federal PPP money that just came down with our good friends at SBDC. And again, Dr. Toomey, thank you and your team for what you do. May God bless our state, and we'll see you soon. Thanks for being with us.
Always a pleasure. Anytime. Thank you so much.
Thanks, Dr. Toomey.